Good morning. I'm Dr. Subhash Chandran, Professor and Head, Department of Pharmaceutics, Emmanuel Arasar College of Pharmacy, Natal. Today we are going to discuss a topic on posology. The posology is a term which is derived from the Greek word posos, which means how much, and the another word is the logos, which means science. Posology is a branch of medical science which deals with the dose and quantity of drug which can be administered to a patient to give the desired pharmacological action. Since patients requires various kinds of dosage forms, it is necessary to calculate doses. The optimum dose of a drug varies from patient to patient. There are several factors which affects doses. They are broadly classified into age, sex, body weight, route of administration, time of administration, environmental factors, emotional factors, presence of diseases, accumulation, additive effect, synergism, antagonism, idiosyncrasy, tolerance, tachyphylaxis, and metabolic disturbance. First, we can discuss about the first factor, age. Human beings can be categorized into the following age groups. Basically, the newborn babies are categorized in the form of neonate, that is, the age of the child from birth to 30 days. Next, the infant, the child up to 1 year comes under the category. The third category is the child between 1 to 4 years. The other category is the child between 5 to 12 years and adult, and last one is the elderly or the geriatric patients. In children, the enzyme systems of the liver and renal excretion remains less developed, so all the doses should be less than that of an adult. Similarly, for the elderly patients, the renal functions decline with the age, and also the metabolic rate of the liver also decreases. The drug absorption of the intestine becomes slower for the elderly patients. In those cases, the drugs should be recalculated and dose should be decreased for the geriatric patients. Next is the gender. A special care should be taken while administering any drug to a woman during menstruation, pregnancy, and lactation. During menstruation and pregnancy, strong purgatives should be avoided. And also, anti-malarials, ergot alkaloids should not be taken during pregnancy because they may cause deformation of the fetus. The antihistaminic and sedative drugs should not be taken during breastfeeding, since these drugs may get secreted in the milk and there is a chance for the child to consume them. We'll consider the body weight. Always the average dose is mentioned either in terms of milligram per kilogram of the body weight of the adult. The average adult dose is calculated for a person with 70 kilogram body weight. However, the dose expressed in this way may not apply for the case of obese patients, also children with the malnutrition. For the thin or the lean patients, they should be recalculated according to their body weight. In case of route of administration, when we are giving drug through the intravenous route, the total drugs reaches immediately into system circulation. So it is necessary to decrease the dose during the IV injection than through oral route or any other route. The effectiveness of drug formulation is normally controlled by the route of administration which we are administering. Next factor is the time of administration. In the empty stomach, the drugs get easily absorbed. The presence of food in the stomach may cause delay in the absorption of drug, and also the presence of food always delays the drug absorption. While administering iron, arsenic, or cod liver oil, they should be given after meal, and antacid should be given before meal. A potent drug is always given before meal. If an irritant drug is given after meal, the drug should be diluted with the food. So there is chances for producing less irritation. Environmental factors. The personality and behavior of a physician may influence the effect of drug, especially the drugs which are intended for use in a psychoosmotic somatic disorders. The females are more emotional than male and require less dose of certain drugs. The stimulant type of drugs are taken at a daytime, and sedative types of drugs are taken at night. So, the dose of sedative drug in daytime will be much higher than at night. And similarly, in the case of environmental factors, alcohol is better tolerated in winter than in summer. Now, coming to the emotional factors, the psychological state of mind can affect the response of a drug. For example, a nervous and anxious patient requires more general anesthetics. A placebo is an inert substance that does not contain any drug. Commonly used placebos are lactose tablets and distilled water injections. Sometimes patients often get some psychological effects from this placebo. Placebos are more often used in clinical trials of the drugs. Accumulation. Any drug which accumulates in the body, if the rate of absorption is more than the rate of the elimination. Slowly eliminated drugs are often accumulated in the body and often causes toxicity. For example, prolonged use of chloroquine causes damage of retina. Some drugs produces the toxic effect if it is repeatedly administered for a long time. Example, digitalis emitting heavy metals because these drugs are excreted slowly. This occurs due to the accumulative effect of the drug. The presence of diseases. Several diseases may affect the dose of drugs. In case of gastrointestinal diseases like achlorhydria, the absorption of the aspirin decreases. In some liver diseases, the metabolism of the drug get decreased. For kidney diseases, the excretion of drugs may be affected. So, less dose of the drugs should be administered for kidney disease patients. A 10th factor is the additive effect. When two or more drugs are administered together, the total equivalent of the effect which is obtaining is called the additive effect. Example, when we are given the ephedrine and aminophylline in the treatment of bronchial asthma. Synergism. When desired therapeutic results needed is difficult to achieve with a single drug, at that time, two or more drugs are used in the combination form for increasing their action. This is called as synergism. Example, procaine and adrenaline combination. It increases the duration of action of procaine. Antagonism. When the action of one drug is opposed by the other drug on the same physiological system is called as drug antagonism. The use of antagonistic response to drugs is valuable in the treatment of poisoning. For example, the milk of magnesia is given in acid poisoning where alkaline effect of milk of magnesia neutralizes the effect of acid poisoning. When adrenaline and acetylcholine are given together, they neutralize the effect of each other due to antagonism because adrenaline is a vasoconstrictor and the acetylcholine is vasodilator. Idiosyncrasy. This is the exemption response of a drug in few individual patients. Idiosyncrasy is also called as allergy. An extraordinary response to a drug from which is different from its